Welcome to Grateful Connections, What Gratitude Built, the podcast where women in business share the lessons, strategies, and gratitude behind their growth. Here's your host, Malinda, leading inspiring conversations that fuel your growth, spark gratitude, and remind you that you're not building your business alone.
Hello, everyone. Welcome to Grateful Connections, What Gratitude Built. Today, I'm super excited to talk to you, my friend Christine Banerjee. Christine has introduced me to so much about women's health and alternatives to some traditional medicine in being more holistic. And so I'm super excited to learn more about what she has to say. So Christine runs a clinic called the Breast Thermography Center. And with this, I'm excited to learn more about that and learn about her business and health journey and how we can help you as women become more confident and empowered in your own health. So Christine, welcome to this podcast. What can you tell me about your background and how did you come into understanding and knowing about breast thermography and your passion for women's health?
Sure. Thank you so much for having me.
Yeah.
I was a person who did not really like over-the-counter meds and was always looking for different things that I could do at home for that headache or for that whatever. And then when I got pregnant, I was like, I really want to help my child, right? As we all do, if that is for us. And so I started to look at different things and found more natural things in regards to that. And then learned about fermented foods and then learned about essential oils. And then, so I kept like learning. And so when I hit 39, breast cancer is in my family. And so, I listened to the doc and he says, go get your baseline mammogram at 39. I'm like, okay. And so I go and it's a horrible experience, as some people have had that horrible experience. If you're on the small side or on the large side, then it's all sorts of different things happening in that smashing experience. And then they scare the crap out of you. You have dense breasts. You have to go get the ultrasound. But they don't really explain it. They don't really why that many women who are younger, 39 and in their 40s, 45, have dense breasts. That's not uncommon.
Right.
But they make it sound like, oh my gosh, it's, so scary.
Rush off into something else. Yeah. More details. Yeah.
Right.
Push through the system.
Right. And so it comes back fine. And then at 40, do the same thing again, same thing happens. And I'm like, there's got to be a better way. And so research and finding thermography, I was very excited about it. But the person who I went to for several years was mobile. And so I would have to wait for her to come to this area. And sometimes it would be in Gurnee, and then it was in Lake Bluff, and then it was in wherever,
Traveling. Yeah. You're unpredictable. Yeah.
And the person wasn't when I wanted her to be here or a little closer or consistent. So I'm like, surely this is the Chicagoland area. There must be somebody else.
Right.
And so I found a chiropractor who was basically retired, who did have the thermography equipment. And she was continuing the thermography in her home, but was basically looking for someone to take on as a technician for her and her people. And so that was how the Thermography Center was born. So I went and did certifications and started doing thermograms.
That's fascinating. So when it comes to the thermography, and did you just discover like this is kind of one of the only alternatives to mammograms, or is it one of the best ones, or how does it tie into basically the overall breast health?
Right. So, I can't say alternative. That's up to you to make those decisions.
Sorry.
Right?
Yeah.
So thermograms have been around for a long, long time. 1982. Some of your listeners were probably not even born then. In 1982, it was approved for breast cancer screening.
Okay.
So it's been around a long time. A lot of countries use it and they don't use mammograms because it's easy. It's portable. It's affordable. It's, it's not, there's no harm. There's no radiation. There's no compression.
Right.
So it's very easy to do. But it's just not the standard of care because that's, the decisions were made from a flawed study way back when. We don't have enough time to go into that.
Yeah.
But thermography is a great tool, whether you use it with mammograms or without mammograms. That's your decision because it looks at the physiology of the breast tissue. So the physiology is saying something's starting to happen when we see changes. If a tumor is growing, a blood supply is needed. So the blood supply, we start to see the patterns in a unusual.
Okay.
So, and then there's inflammation. Inflammation from could be lots of different things, right? But if we're seeing these inflammation patterns, the physiology is changing, then it's like, hey, something's happening where you can change your lifestyle, work on your emotions, do your skin brushing, do all the good things we know we're supposed to do, right? To reduce the risks. Now there's ultrasounds, which we have the ultrasound technician come to our location once a month, once every other month to be
Okay.
at active 2 thermography. So you get that anatomical look. You don't need a doctor's order. You don't need to do the mammogram first. That's up to you. And it's a great look, anatomical and physiological together.
Wow, that's impressive. So I
Mhm.
know at the clinic you also do full body scans or partial body scans, and then
Mhm.
you have some other features or support that you offer
Right.
at the Breast Thermography Center. So can you
Yes.
expand on all the fun holistic things that you all do?
There's so many things.
I know, that's just why it's so fascinating to me. And
Right.
I feel like we always, we live in such a space where we just don't know what we don't know. And so I
Mhm.
had no idea that breast thermography was a thing. I had never even thought to look into a more natural path because again, you get caught up in the medical processes, right? So your
Right.
OB recommends every year you get the script, you go to do the thing, and you just don't even
Mhm.
think like there could be alternatives. So
Right.
I just love and I'm so passionate about what you do because it is such an empowering position to put women in when they can think about their health in other
Mhm.
ways. And if we don't even know what the options are, we don't even know to explore. So that's why I feel like
Right.
there's so many cool things to learn about what you do and your perspective on natural health.
Yeah, I think that's part of the problem. And one of the things I talk often with my clients is that we don't stop to think about what we're doing.
Right.
Radiation is not, it doesn't just go through your body and go out into the atmosphere or whatever people think. It's cumulative, it stays in the body. So if you're doing your breast mammogram, they call it a mammogram because they knew women wouldn't do it if we called it a breast x-ray.
Mm.
So think you broke your foot, you got 14 x-rays there, you had your whatever scan, you had your dental x-rays every year, you have your, I mean, it
Mm.
accumulates, right? So now I've forgotten the question.
Well, no, I just want to understand more about the holistic approach
Oh, what
that you
else we
have
do?
at the,
Okay,
yeah, what else is
okay.
at the
I see, I
thermography
have to
center?
have notes, I go on a tangent.
That's okay.
So I have a lot of different certifications in a lot of different areas in nutrition and oils and, lots of different things. So my favorite tool that I have is called New Vision, and it looks at the
Okay.
cause and best solution for what's going on in the body. We can do a mini scan, which is just the top 10 things that would be most beneficial for your overall health right now. So that's a
Okay.
great way to get a report that says, hey, here, start with these things, because
And what does it do? Like, is it is it another scan or
it's
is it?
it works with a computer program and your information in the information field.
Okay.
So it's not related to thermograms at all.
Okay.
But I can look at one of the work sets there that I can look at, like information data sets, is breast health. So I can say, hey, what is impacting negatively breast health and what would be really good for breast health?
Okay.
Or we can look at nutrition, we can look at pathogens and toxins. Let's say you're a hairdresser and this particular toxin comes up and, oh, gee, it's in hair dye. That's really
Mm.
negatively impacting you. So, okay, maybe switch different dyes, do less hair colors, I don't know. Um,
Right. Come up with some solutions.
Right. So I love it. It's a great tool because it points people in a direction. So if top 10 things isn't enough and you want to say, "Hey, I have all these issues." We can enter all those issues into the system and it looks through the 50,000 different data
Oh, wow.
sets and says, "Hey, here's the cause and here's a best solution for you." So some
Okay.
people really respond to essential oils, some people really respond to homeopathy, some people really need support in nutrition. Some people need detox. Some people need just to drink more water, So
Okay.
we can pinpoint that, taking out my bias. It uses
Okay.
all of the information that I know and then some. I learn things all the time from it,
Oh, I
but
bet. It's
out
gotta be
my bias.
fascinating.
So it's really cool.
That's awesome. But how would you present this new vision to a client? Like, is it something when they come in and talk to you about their breast thermography, you say, hey, this is another thing I have? Or do people come to you just because they want to explore? And how would you explain that? Or what would be the invitation?
That's a very good question. I should think about that a little bit more. Sometimes, when people are acclimating to the room temperature, they're sitting behind a screen waiting to acclimate. It's 15 minutes. So we have time to chit chat, right? And often
Yeah.
in that chit chat, women will share with me, oh, they're struggling with hormones, or they're feeling like this, or this and that's happening. So, well, first I would ask questions, well,
Sure.
are you working with somebody on that? What have you tried on that? And then if it's kind of like I'm stuck or I don't know what to do, then that's when I would offer to say, hey, I have this great tool we can look at to see what the cause and best solution is. Would you be interested in that?
That's cool. Yeah, because I would imagine when they're, like you said, when people are talking about just their overall health, they're either being proactive or they have some concerns and are coming in to see you
Right.
for each of those, right?
Mhm.
So, can we focus a little bit more? Because I know you are very passionate about this too. In addition to thermography, what is another or a list of, I've seen you talk about this before, when it comes to breast health overall, what are some of the things that we as women should really be focusing on other than just doing, set it and forget it, right? We go to our mammogram, we come get our thermography. But there are things that I know that we can focus on that I think would be really helpful for women to learn.
Yeah. So that's one of the things that I don't like about the mammogram model is that you check it off your list. I went, everything's fine. It's like,
Right.
well, but that just means they can't see it. It's not big enough yet, but it
Right.
doesn't appear overnight, right? So
Yeah.
there are things that you can do to reduce your risks of ever getting cancer. And that's one of the things, like when we see thermograms start to get a little suspicious, it's like, okay, we'll shore up some of
Mm,
your to-do list so you can take control over your health. 90% of breast cancers, and even maybe more, is lifestyle. It's not genetic.
wow.
So we want to say, oh, the bad luck of the genetic lottery, that's just not the case. It's our environment.
Interesting.
Some things we can have control of and some things we can't. So get your vitamin D levels checked. So many people are so low, deficient in vitamin D. If your vitamin D is over 60, what is it, nanoliters per deciliter, it's an odd measurement,
Okay.
that is breast health protective. But 30 is like,
Wow.
oh, it's okay. Well, 30, if at 30 you don't get rickets, okay, great.
That's so fascinating. I would have never put that together. Like,
Yeah.
I do go to a rheumatologist for my psoriatic arthritis. And
Mhm,
so vitamin D is definitely something that is measured and monitored
mhm,
with. So I do
mhm,
take a supplement for that, but I had
mhm.
no idea that was tied to breast health.
Yeah. That's
Interesting.
an easy
Okay.
one, right? You get
Yeah.
it checked and get out in the sun and skip the sunscreen once in a while. And another thing would be eating adequate amounts of fiber.
Okay.
28 is a number that's not, go with your care provider to tell you what you should have, right?
Yeah.
But at 28, it's very helpful in the estrogen detox and the recycling of everything. So if you don't eat a lot of fiber, then the estrogen can float more freely. It doesn't really get attached to the fiber and go out.
Okay.
So simple, right? Add
Interesting.
leafy veggies and eat some more fiber, right? Let's see. I have my list right here. I want to pick some good ones.
Yeah, that's good.
Some things that we can do. So sugar, sorry, don't eat
Ooh.
it. Save it for super special occasions a few times a year. Every week should not be, every day should not be a special occasion to eat sugar. Sugar feeds cancer. The
Yeah.
end. It does.
Yeah, and that's one of the hardest things to get rid of. I've done
Right.
so much better, but I am not at 0, that is
Right.
for sure. Like,
And
definitely reducing.
so just instead of shaming ourselves or feeling guilty or whatever, just do better, right?
Yeah,
Just every day, one step better, one step better. If today is a sugar day, then tomorrow isn't. And you can say, yay, it's been one day.
right.
Not be like, crap, I did it wrong yesterday,
So
right?
let's overindulge today.
Just be
Get
done,
back. Yeah,
right?
exactly. I love
So
that.
So even if, let's say we had 2 teaspoons of sugar in our coffee, I drink black coffee, but 2 teaspoons of sugar in our coffee, and we had 4 cups of coffee that day, just try one teaspoon in each cup.
Right.
Just try it. then and congratulate yourself you had 4 instead of 8, right?
Yes. Yeah. It is. I mean, it is a tough one, but it really is. Once you start kind of separating yourself from the sugar and you just don't need it as much, but it's the
Right.
craving sometimes just
Right.
take you over the
Well,
edge.
it's the gut bugs and the candida and the fungal whatever that says, "Send down the sugar."
Yeah.
So another one that you can do is limit bra wearing. See, I would just like whoosh, whip it off,
I
right?
love that.
That it's a lot of restriction for or at least try softer, not underwire if you can get away with it, or only wear that underwire in that business meeting or whatever when you really have to feel professional, but wear
Right.
something a little less constricting. There's tons of lymph nodes in the underarm area, in the breast tissue area, that lymph is supposed to flow like skim milk, like really thin.
Okay.
A lot of times it's like cottage cheese.
Yeah.
So stuff is congested in there, and that's like holding toxins in. And that's why if we look at cancer studies, 85% of breast cancers are in the upper inner quadrant. Why do you think that is?
Because there's too much pressure
Much
surrounding
pressure
where we're, yeah.
and aluminum deodorants.
Mm.
So those are some simple things, to help the lymph in that area. It's like, okay, well, half the time you wear a less constrictive bra, maybe you take your bra off when you get home, is to massage the breast tissue or even do some skin brushing. So that's with
Yeah. What does that mean?
I should have grabbed one of the brushes and had it here for us, but it's so you can look online for lymphatic brushing or skin brushing, but basically
Okay.
you would use like a shower brush, but it's kind of soft. And so you would gently brush the skin like
Okay.
this. You don't have to press hard from your feet all the way up to the top, well, you could go up to your head, but
Yeah.
heart, and then your head, you would come down to your heart. It's always towards your heart. And you would gently do this before you get in the shower. And in
Okay.
breast tissue, you would do starburst pattern out from the nipple, and under the arm would be an upside down J.
Interesting. Okay.
So, I mean, there's lots you could YouTube this or whatever and find it, but it takes 5 minutes, or you could spend 15 minutes, however long
Yeah.
you wanted. But it is a simple practice. It'll help the skin slough off dead skin, help cellulite, help the lymphatic system, of course, help breast tissue because there's a lot of lymphatic tissue there. So it's easy, 5 minutes, right? And
That's
even if you
awesome.
did it twice a week, it's better than none.
Yeah. Okay. That's awesome. And I know that you have a lot of experience also with essential oils and other
Mhm.
natural treatments. So can you expand on, I mean, to me, that's so fascinating, like what the oils, different ones can do and how they work. Can you just give a summary for those people who have no idea what essentials
Right.
do
Right.
or other than smell good? Because I know
Right.
that that's amazing. I love having them around the house for that. But I know that there's some other health benefits as well.
Yeah, I think essential oils are fascinating when you get a good quality essential oil. That $3 bottle of lavender at,
Some grocery
Walmart,
store somewhere. Yeah.
wherever, that's a toxic chemical. That's nothing, right?
Right.
So if you get something that's really from the earth, I believe that the plants were here for us for a long, long time. There's all sorts of herbal medicines and things that were, people used for a long, long time before pharmaceuticals came along. And it's the same concept as essential oils, a good quality brand. You can use it for just about anything. And, to your point of it smelling good, well, if you're using cleaning products or something in the house, I want it to smell good, right? That's what the
Right.
plugins are about, and all those very, very highly toxic things that do your body no good,
Right.
and replace. So that's one way to use essential oils is to replace those toxic things that we want. We want our houses to smell good, right? But
Sure.
also they're great for first aid in your toolkit of de-stressing, sleep, helping every body system. Essential oils can help. And I'd love to, anybody who wants to know about that can contact me later. But
Yeah.
it's a great tool in the toolbox, and that's what I think is what they're wonderful.
What's your like which ones do you have kind of like at your grab? I know that
Oh,
that you
my
love to.
favorites. So
Yeah.
I use frankincense a lot.
Okay.
It is a little spendier, but it's worth it, and how it grows and where it comes from and all that. But that's excellent for breast health. So I do rub it on my
Okay.
breast often. Like Stress Away is a blend that I love. It's just kind of cools everything down.
Yeah.
And RC, I love RC. It's a blend of myrtle and eucalyptus for
I have it, but I have no idea what to use it for.
it's fabulous. It has great stories that I could tell about this one, but it's great for like to rub on your chest to help breathing,
Okay.
and just open up the airways. And, if you have some seasonal discomfort or that, whatever's going around, it's a great one for that.
Okay. Awesome. So let's talk a little bit about the start of the Breast Thermography Center.
Mhm.
How long ago? What have you been doing to help grow this business? I know that your passion is truly getting to women, which I love. So
Mhm.
it's like something you can be passionate about for yourself as a business growing, but then also the perspective of really truly being resourceful for women. So tell me
Mhm.
about like the growth. When did you start? How have you been really focused on growing this business?
Yeah, it was about 7 or 8 years ago that I joined with Dr. Kelly and, set up shop, so to speak. I think, I'm not great on social media, but I think you do have to put yourself out there and say yes to every opportunity. Yes, Melinda, I don't know what I'm doing, but I will come be on your podcast.
Yeah, exactly.
Networking, knowing who your target is. I can go to lots of networking groups, but when they're mixed men, women, not that they don't, the guys don't have wives and girlfriends and moms and sisters and whoever, but it's just not quite the same.
They just don't understand like the intention or like the
Right.
intensity of what this impact really can offer. To them,
Right.
they're like, well, my wife gets, a mammogram or
Right. She's
whatever. Right.
good
So,
and it's done. Right.
yeah.
So don't waste time in your not your target audience. So know who your target audience is and do things to put yourself in their path.
Yeah.
Is like, that's what I try to do.
Yeah. I think that's been very helpful. And you've also spoken a lot. You definitely take some speaking opportunities where you can to really educate. And we can absolutely gain insight from all of
Mhm.
your expertise, which is why I love talking to you about this because I just feel like, I know the surface, right? I know that it exists, but
Right.
clearly you have so much information and so much background just on natural health in general, which I always love getting that insight from you.
Mhm.
So that's great. When you've been working on growing the business and building your community of women, what were some of the things that you've maybe learned that if you went back 7 or 8 years ago, is there anything that you've taken back and said, gosh, I wish I would have known this sooner? Any like mindsets or tools or anything?
I would say be patient because especially if you have something that people don't know about, there's a lot of education time that has to
Yeah.
happen. So be patient. So like for instance, going to a networking group and be like, the first year nobody came to me. I guess I should just give up because nobody
Right.
wants, that could have happened. But it wasn't until year 2 that people got to know me. They liked me. They understood it more, even though they heard me say what it was month after month after month. They still kind of didn't really
Sure.
get it. And then
Sometimes, yeah. Go ahead. Sorry, I didn't
so,
mean to cut you off.
it was in year 2 where people started to come to me as, hey, I want to do a thermogram now. I get it. So
Yeah.
be patient.
Someone has to see something, hear something, probably 15, 20, 30, 40 times sometimes before they
Right.
take action. They're like,
Right.
oh, yeah, that makes sense. Oh, okay. Well, wait, I've heard a lot about this now. It's about time for me to take
Yes.
responsibility for myself and make
Mhm.
this happen.
Yeah.
So if you could on both either the business or just the health side, if you could wave a magic wand and have every single woman take away something, what would that be?
I would say listen to your intuition.
Oh,
So
that's
many
good.
times women will say, I really didn't want to do it, but I did it anyway. Or I
Yeah.
started to ask questions, but I got shut down. And so I just had to do it. No, you
Mm,
don't have to do it.
I love
Medical
that.
providers work for you, right?
Well, so they should be, but
But they
many
do.
times, yeah,
If they don't want to listen to you, if they don't let you ask questions, if they don't hear you out and give you the answers that you want,
I love
fire
that.
them and go someplace
Yes,
else.
right. Because your
You
intuition probably is so strong when it comes to your own body. And
right,
if somebody says, oh, nothing, like you said, if a mammogram shows nothing, but you still feel like there's something off,
right,
pursue and push further to find answers.
right.
I love
So
that.
don't stop asking questions. Don't be afraid to get a second opinion. I mean, with respect and kindness, of course,
Sure.
but don't be pushed into that, oh my gosh, it's found today and I have to go 2 days from now. It
Right.
didn't grow overnight. You can take a week, take a breath, get a second opinion, a third opinion, find
Right.
out all the answers you want until you are comfortable doing whatever it is you're going to do that's
I
right
love
for
that.
you.
I love that. So where we are here, you're in Libertyville. So our local listeners could easily schedule an appointment with you. Do you have any recommendations? Do you know how common thermography centers are outside of this area? If somehow somebody listens to this far away, are they kind of like,
You're going to
you
say
think,
thermography near me in my city.
okay,
They're kind of few and far between. Don't be surprised if you can't find somebody, or you might have to go across the state line if you're close to a state line. There are only 4 or 5 in the Chicagoland area that I know of,
interesting.
which
Okay.
is crazy because there's a lot of people here. So
Right.
they're few and far between.
Well, I think a lot of it's just education and getting the word out
Mhm.
as well, right? So many people don't even really know. So where can we find you, Christine, online, or where could people come to? Yes, exactly. Look at your face. Where can we come to find more information about the Breast Thermography Center and come schedule an appointment with you?
Sure. So the breastthermographycenter.com without just breastthermographycenter.com.
Okay, perfect.
Or you could call 224-358-2741 or send me a text. I
Okay.
will get that and follow up.
Perfect. Well, we'll add that all to the notes. And I appreciate your time, Christine. This is so
Thank you.
fascinating. And there's always so many great things to learn. And really trying to focus, even on my own health journey, to find as many natural paths to health
Mhm.
versus just going straight for medication or staying in the traditional medical field. So I
Mhm.
appreciate everything that you do and in the word that you're getting out and spreading information to help women with their breast health. I think it's such an important message and you do such a fantastic job at it.
Well, thank you for your kind words.
Always, my friend. Okay. I appreciate you and we'll talk to you again soon.
Okay. Bye.
If you enjoyed this episode, I would love for you to subscribe so you never miss a conversation. You can find me at gratefulconnections.com, join our private Facebook group, Grateful Connections, and follow me on Instagram at gratefulconnections_co. Sharing is an act of gratitude, so please pass this along to another woman in business who inspires you.
We're so grateful you joined us on What Gratitude Built. We grow stronger when we grow together. So stay connected, stay inspired, and let gratitude lead the way in your business and your life.